So I'm going to establish the quorum now that she's got the recording, and then I'll read the script for open meeting law. So, Bert,
Here.
Joanna,
Here.
John,
Here.
Ruthie,
Here. Here.
as a preliminary matter, this is Dorothy Hertz, Chair of the Contract Review Committee. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Bert,
Yes.
Joanna,
Yes.
Ruthie,
Yes. Can you hear me?
yes, I can, Ruthie, thank you. John Balash?
Yes.
Okay, great. Staff, when I call your name, please respond in the affirmative. Jericho Mealy,
Here.
Ned Median,
Here.
and anticipated speakers, we will have none, so I'm not going to go to that. Good morning, everyone. This open meeting of the Contract Review Committee is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020. Due to the current state of emergency in the Commonwealth and due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we have been advised and directed by the Commonwealth to suspend public gatherings, and as such, a governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which you can find posted with agendas materials for this meeting, allow public bodies to meet entirely remotely, so long as reasonable public access is afforded to that the public can follow along with the deliberation of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. For the contract committee is conveying by video conference on the Zoom app as posted on the town's meeting website, identified how the public may join. Please note that this meeting is being recorded and that all attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and will take care not to screen share your computer. Anything you broadcast may be captured by the recording. All supporting materials that have been provided, members of this body, are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I note otherwise. We are now turning the first item on the agenda, but before we do so, permit me to cover some ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I, the chair, will introduce each speaker on the agenda. After they conclude their remarks, the chair will go down the line of members, inviting each by name to provide any further comment, questions, or notions. Please hold until your name is called further. Please remember to mute your phone or computer when you are not speaking. Please remember to speak clearly and in a way that helps generate accurate minutes. For any response, please wait until the chair yields the floor to you and state your name before speaking. If members wish to engage in a conversation with other members, please do so through the chair, taking care to identify yourself. After members have spoken, the chair will afford public comment, which actually does not abide by us today. Finally, each vote will be taken. This meeting will be conducted by a roll call vote. Okay, hi, everybody. Can I get an approval of the agenda?
So moved.
Second.
Okay. Bert Johnson,
Here.
John Balash,
Aye.
Ruthie,
Here.
Joanna,
Here.
Brooke.
Aye, here.
Hi, Brooke.
Hi.
Okay, and the only person not here is Linda Williams. Has anybody reached out to Linda? No?
I sent her the agenda.
No, I know. I'm gonna just text her and just remind her that we're in meeting, everybody. Just so everybody knows what I'm doing right now. I'm gonna start with Bert and John. You want to talk to us about your meeting the other day?
Well, I wasn't in attendance because I could not get my Zoom to work, so John had to carry, I forgot, by the time I got there, I couldn't get in, so John did it, I guess, by himself.
Yeah, I didn't do it. Oh, excuse me.
You okay? Drink some water.
Yeah, I choked on a grape skin. So I had a meeting. Where did I put my notes? But anyway, I met with, I had them all. Anyway, I'll come up with the names in a minute. Matter of age, I can't keep names in my head for a minute. But it was a very successful meeting in the sense that they really reaffirmed what they told us before about adjusting to COVID and having cut back on their requests for daytime for after session snacks during the regular year, but they are hoping to have a full summer program. I think that perhaps I really, there wasn't much to add, but I did learn something that was kind of interesting to me, at least, because they can no longer offer fresh fruit because the health department told them that they don't have a facility where they can cut it up in small enough pieces. Previously, Stop and Shop was providing them the cut up fruit, but it was in too large chunks, and it offered or it created a choking risk for their youngest because they have children from the infants basically, so that they've had to scramble to figure out how to provide the snacks and where to get them. That was, I think, the most interesting new information to me. And they were hoping somehow that they could address that sometime, but it was the health department that both basically told them that they couldn't do it on site. Other than that, I really don't have much to add to what they presented at their meeting before us, except that I came away with a strong impression that they have very strong leadership in place who are, as I said, if I could remember the names, maybe I'll come back with them if you ask me later on, because I'll go grab my notes.
Hey, John, I'm gonna
Yes.
intervene. I believe you met with Nicole and Jason and Jackie.
Yes, Nicole and Jackie, and Nicole was the one who really carried most of the conversation. She comes across to me, at least, as extremely competent, extremely equipped, and with the kind of attitude that leaves only a positive impression.
Yeah, I believe that she's been one of the longer termed, I want to say headmasters of the school.
Well, she's certainly, I mean, she came across with, I mean, as somebody with energy and clearly nothing is going to defeat that woman.
That's good. They need that right now.
That's well, I really mean the people that they chose to be on the meeting with me certainly look to me as if they're forward looking and not feeling defeated, challenged, but hopeful, of course, as all we are, that the world will settle down and I think they are sort of realistic about the possibility, as the doctors are suggesting, that we are going to be living with some form of the virus for a long time to come, and it's going to become something like the flu, but obviously somewhat with potentially more serious consequences.
And was there any word on their luck on staffing, on how they're doing with staffing?
I did ask about that. She has her advertisements out. They have not been able to increase their staff currently. That is what is limiting their number to 33. But she said it's challenging throughout the state, as it is throughout the country, to find anybody who actually has the qualifications. But we did discuss the fact that the state, I actually asked the question, and she shared with me, and now with you, the fact that the state is re-examining their requirements, particularly their educational requirements, in terms of expanding what will qualify somebody to be licensed. I think there's a general recognition that perhaps they're a little, what is in place is a little, well, for want of a better way, places requires too much emphasis on pure academics and does not give enough credit for various other experiences. Obviously, you'd have to produce sufficient evidence or proof, but that there are other things that can qualify you to get licensed that are not yet, which would expand the potential pool. And this is something that clearly from what Nicole said, basically indicates that the state is seriously looking at this, and basically that's what is, in the moment, the best hope that they will find a larger pool of candidates to try and attract
More staff, yeah.
Yeah.
I think that'd be good for a lot of people and a lot of different programs. Okay, I'm going to move on to the next one. Thank you. Thanks, Bert, John, for doing that. Really appreciate it. I will go on and, hey, Brooke, are you there?
I'm here.
Hey, Brooke, I'm going to have you, let's talk about, we did a few of them. So why don't we just discuss a few that we did and present those?
Okay.
So how about we start with Martha's Vineyard Community Services?
Yeah, we met them on Zoom. Was that yesterday? I'm losing track of time.
Yesterday.
What an impressive group of professionals. They have Kathy Hackett, who is working her way toward retirement, who's been sort of the stalwart of the program. Their programming here on Nantucket. They've hired someone new, and is her name Amanda? I'm drawing, yeah, John, you and me both, right? On the names. Anyway, interestingly, she's based on the Vineyard and Kathy was based on the Cape. And we talked a little bit about the transportation headaches of island to island travel. And they've clearly focused a lot on that and have figured out that there's one day a week that Cape Air flies a morning flight here and an afternoon flight back. And so they're really thinking about being able to provide services in person here as much as possible and looking at those transportation challenges of being a shared islands programming. Their focus on the inter-island connectivity of families they work with, I thought was really interesting. It's something I didn't really know about that they have tried. Obviously, the pandemic has thrown a lot of things for a loop, but they try very hard to do programming to introduce their client families on Nantucket to their client families on Martha's Vineyard and broaden the networks of connection and peers for those families, which I thought was really great. I learned a lot about Martha's Vineyard Community Services overall as an umbrella organization, and found that really interesting in terms of what they do in what they call service line collaboration and coordination. And overall, I can't say enough about their commitment to Nantucket families and the value of the service that they provide. I was really, really impressed by their energy and by their deep commitment to our families. And I tried to drop a few Vineyard Nantucket jabs, but they didn't land very well. They they don't think in those terms, so, which is great. So, and that's not my nature anyway, but it was sort of funny how flat it fell because they didn't really even know what I meant. So, but great folks, great energy, and really inspiring to me.
Yeah, I think they're one of the most consistent programs that we've ever dealt with. Consistency is their key and their strength. They've got it. They know what they're doing, and they use it beautifully.
Sorry. The other thing that comes to mind is their level of collaboration with other organizations. They know they're not based here, and so they really do a great job of working with other agencies on Nantucket to do collaborative work. STAR and the SNAC, which is the Special Needs Advisory Council at the school, and just the creativity of their ideas around programming is also really inspiring. So just great ideas, and they're open to anybody proposing an event. That sort of that grassroots suggestion of, wow, we should do this, and they're happy to help make it happen here, which is very cool.
They also adamantly work I just want to reiterate this, with the school in offering programs to teachers. They bring people over on the educational days and offer that. So that they also work within the school and the special ed office. They have a great relationship with the special ed office because for them, sometimes they're the key. They are the representative of all these kids through DMH.
Yes.
It's really a wonderful program. Okay, let's go on to health imperatives.
Okay. So I was thrilled to finally see the health imperatives space, and to be wowed in the way it has been was reported to me on these calls last year about everything they accomplish in the space that they have. And they are, of course, going through a leadership transition, but are committed to making themselves available when situations arise that need to be handled immediately for their clients. And they're being very creative about how they're looking at future staffing. They're sort of recruiting with an eye toward a couple of different models of leadership. One person like Sunny, or divided up among several people, and they're basically advertising broadly for several different potential models for replacing Sunny, and with the understanding that Nantucket's a unique place to recruit, and that they want to make sure that they're being as open-minded about who might have the skill sets in combination, rather than trying to find a single person to take over for someone who had an extraordinary combination of skills in one person, which is often really hard to replicate, and especially for someone who has housing on Nantucket. One thing that I learned recently is that 3 staff members at Health Imperatives, including Sunny, live in affordable housing, deed-restricted affordable housing. And that was pointed out to me that their capacity to staff has depended on that. And they're aware very much about their salary ranges, and are trying to be more realistic about what they might need to offer for compensation to fill those positions. the breadth of services, the community that they serve that is underserved by other healthcare systems on island is deep, and they probably have one of the most I'm going to use the word deep again, connections to folks in our community who often are uncomfortable coming out and seeking help. And they have built amazing trust among our immigrant populations and the uninsured, and that people feel safe coming to them, that their privacy is protected. And the other thing I found really interesting is the staffing crossover between health imperatives and the hospital has helped improve the handoff of someone who needs more services than health imperatives can offer in the medical arena. And so it's a warm handoff. One area we talked about was obstetrics and other, when someone is perhaps diagnosed with something that needs further follow-up at the hospital level, that some of their staff work in both places so they can help ease that transition for them, which I thought was also really important piece of the puzzle for them. Just loved the energy. It was empty. There was no clinic that day, so it was just the space. But I'm a doctor's daughter, and it's a very different environment they're working out of from what I knew from my dad's experience, and they make a lot out of very little. And of course, that's the perennial question for a lot of these agencies is what happens next in terms of where they will be housed in the future. And that's a bigger conversation for the community. So,
Right, and I think
anything else?
I think one of the other things was just to note that they saw over 1,000 clients
Right.
within that space, which was something to be noted. And the retention of the staff, most of their staff, they have great staff retention. Some of it housing, yes, but also some of it has to do with, we spoke with the woman that's been with them. She runs the Hyannis office and comes over and is helping right now. She's been with them for 19 years. And a lot was spoken about Julia, who is actually everybody's boss that actually runs this from the Cape, runs it from Boston, Brockton. And also the fact that their collaboration with other organizations is key. They collaborate with a lot of the other, and I know that I can speak just from conversations I've had with Jericho, that he felt that Health Imperatives was right on top of the game with him throughout COVID. And helping with the COVID vaccines and so forth. So a wonderful organization. I agree with you, Brooke, 100%. I'm always amazed at what they produce in such a small little space. And people feel so a part of it. And also what's important also is not only immigrant population, they see a lot of the younger kids that don't know where else to go for birth control and reproductive health care. So they see a lot of the kids from the high school level who don't have health insurance or are a little timid to discuss it with their families there, which is very valuable to the community. Okay,
or their family doctor that also sees their parents and all of those things. Yeah.
And they feel, and the biggest thing I hear from the kids is, and I sort of wanted Brooke to hear this from the staff, is the respect that everybody has for the nurse practitioner there. An amazing woman that does an amazing job, and a lot of people just feel extremely confident in her. One of the big things, which is true, that, and I told this to Brooke, and is that not only there, or also when she's working at the hospital, is they have a joke, like if she's a 30-minute thing, book 45 minutes to an hour. She's an old-time doctor that does the same thing in the clinic. It's not about how many people she sees, it's about the quality, and she will stay late to make sure she spends that time with every patient so that they understand exactly what's going on, and she listens, which is really important in this day and age. let's go on to the next one. Brooke, I'm gonna just stay with us and get the three that we did done and then.
Mhm.
So the next one will be Nantucket Cottage Hospital. And as everybody sees, Linda joined us.
Hi,
Okay.
Linda. So we met with Elvis from the finance department and Sarah Chakowski, who's the director of social work, about the ambulance contract and behavioral health transportation contract is what I should describe it as. I did sort of broaden the conversation a little bit. Obviously the constraints of regulation around what healthcare organizations can and can't do in the space of treating behavioral health patients has changed over the years. And this transportation situation is formalized and highly regulated, and therefore how it's done and the expense of that is obviously not the same as it was when someone could take someone in a car and get a emergency reservation on the boat and drive them somewhere. That just doesn't happen anymore in liability landscape. And I think, as Dorothy and I were saying, the Cottage Hospital also now answers to a larger organization, and that changes the dynamic of sort of community hospital thinking versus hospital system thinking to some extent. We asked what happens when the contract funds run out, and Sarah was clear that the only time she knows that how this is handled is when she does the quarterly reports. And so it was very important for us to know that she is evaluating someone blind as to whether or not there are funds available for their transportation through the contract or not. In other words, she's not, she doesn't have that filter in her head of there's no money for this, the hospital's going to absorb it if it's the appropriate thing to do to transport someone off island. So I thought that was kind of an interesting thing to point about as a trained clinician myself, to like not have that in the back of your head. You shouldn't anyway, but not knowing it is better than knowing it and trying not to have it affect your thinking. And then I was really curious about the relationship dynamic between the Cottage Hospital and MGB in terms of, Dorothy and I were talking about grant writing and fundraising and just the financial dynamic between the organizations. And I'll be honest with you, I noticed a pregnant pause when I asked the question. And I think it's a very complex relationship. And I think it's hard for me to understand what financial resources Nantucket Cottage Hospital has access to as an affiliate of MGB. And my understanding is it's NCH to MGH to MGB. There's like two layers of hierarchy. And so it's just complicated, and that, they need sort of permission from the system to apply for grants to make sure they're not competing with other affiliate hospitals in the system when they apply for something. It's super complex. And I knew it was, but hearing them talk about it in that granular way was illuminating to me. There was another thought I had. She told us, I asked her about the space where people are boarded when the average time between their arrival at the ED and their transportation off island is 4 days for a behavioral health patient. And it is
for adults
and 7 days for children, for minors. And the reason for that is bed availability. It is not that they're doing anything wrong. Doing a bed search and finding an appropriate placement for adults is hard enough. It's even harder for children. And then she pointed out an added complexity of generally intake staff at these hospitals don't work at night. And so if you can't get the transportation set up to get someone to a place during the hours that the intake staff is available, it's another day. So those are some of the complexities that I was not aware of. And then I know Sarah had mentioned when she came to our meeting that, they have to bed search through the entire system. And so they could be taking a child to Western Massachusetts. And then the other thing I talked about whether parents are allowed to travel with their children. And she said, it depends on the circumstance. And often a parent literally can't travel depending on where their child is being taken, because imagine time off from work, traveling on the boat, being transported with your child to somewhere in central Massachusetts, and then having to find your way home with no vehicle. And if you're a single parent and there's no one available to come get you, how do you get home from there? And so, I mean, it just the complexity of this is compounded by our geography, as we know most everything is.
But they did, Brooke, let's just touch on the fact that due to COVID, they do have the new process where
Right.
instead of having to attend, maybe go with your child to the hospital, they do have the ability to do the paperwork and take care of it here.
Yes. Yeah.
Yeah.
Yeah. So in that world of minor psychiatric treatment, typically a parent would have to be eyeballs to eyeballs to sign the paperwork. It can't be done remotely. So what they've done is set up a system where Sarah has the parent in the room with her, and she's the eyeballs for the receiving placement for the parents to sign. There was some other thought I had about our conversation.
We did
Dorothy, if
ask,
you want to add anything.
we did ask about, one of the questions we did ask about was whether insurance was, how have they been looking at insurance? Because from I have an understanding that maybe insurance is covering the transport part, not the boat part. And since insurance has changed drastically during COVID, whether or not they are looking at getting insurance reimbursement for some of this. And they are looking into it for us and said they will, and we've asked that be done ASAP, actually.
Mhm.
And we asked about grant processing on the island, whether or not they do the grants from here or whether they're done through the higher partners at MGH and MGHB. One of the things that I have been able to talk to the chief financial officer a few years ago when we asked this question, and I know that Nantucket runs on its own budget under the protocol of the town. Somebody just is letting me know their computer broke down and they're restarting. I think that was probably Linda, everybody. And so that was interesting, is how, the finances actually do work, in the fact that they actually do have their own budget underneath everybody else. They have to run their budget. But we did ask about, and I think the big thing is, I asked about whether or not they take care of other ambulatory care. Would they be obligated to this ambulatory care? And the answer is yes. Right? So it was very interesting, but something we should keep in the back of our heads. I think that's it, right?
Yeah, and the only other question I asked is, why don't people go on helicopters? I knew the answer, but I wanted to ask it anyway. Is that the med flight program will not take the risk of transporting behavioral health patients.
Okay,
So-
I'm going to go on. The safe place, we did not have a chance to interview because of the fact that Jen got COVID. And so she's been out. So I'm gonna go on to Linda, are you on yet again? Or is she still not on? No, she was back off again. Okay. She's gonna come back in a minute, I guess. She just texted me. So why don't we go on to, I'll talk a little bit before she gets on about the food pantry. I went down and interviewed at the food pantry. And asked them about what they felt their obstacles were. And they felt one of them was their ability to have perishable food available and space. Those were two obstacles they saw they had. I went over and asked how their intake process happens, how people feel during the intake process. I brought up concerns that we have had over, or concerns that are brought forward to us after speaking with Reverend Maxwell, which I had met with Reverend Maxwell and some of the staff that's been put together, the committee that's been put together in regards to the Interfaith Council and the food pantry and their task force. And I decided that it would be a good idea to ask them where their obstacles were and how they saw it. And I asked them if they felt, I said, so we've been informed that some people feel they are discriminated against. They feel uncomfortable coming in the door. And how do you feel about that? And is there any way that you see that happening? Very clearly right off the bat, they told me no, they did not. They wanted to know, they wanted me to give them exact incidents of it. And I said, you know, it's come to us through so many different channels. I'm just wondering if you can step back sometimes and look at it and say, am I doing something that's offending somebody? Is there a way I'm coming across the wrong way? Is there a way that, you know, something isn't appropriate, you know? And they started talking about people getting upset when they did applications, they'll walk out the door because they're asking too many questions. And then I said, well, do you have anything posted that says that these are requirements from the Boston Food Pantry, that you have to ask this? And they don't. And they said, well, nobody reads. And I said, well, that's a lot for you to determine that nobody reads. I think you need to post it in English, Spanish, and Portuguese on the wall and allow them to have the opportunity to not read if they choose not to read it, but don't assume they're not going to read it. They talked and they believe that a lot of what their problems stem from the space that they're in, which they are looking at a lease that will carry them, that they'll have money for about 1.5 years. They don't know what their plan will be after 1.5 years. Clearly, space is an issue. They produce a lot of food, you know, they distribute a lot of food out of a very small space with very limited refrigeration, because even though they have storage, they really can't keep freezers and refrigerators working in the storage facilities where they store their food. I asked them about technology and whether or not they felt that they had a system that actually utilized the best resources available to them, and how would they be willing to be partners with somebody that would work on their technology. I'm under the understanding that there's something out there that's a possibility that will be coming down the pike for them. And they were quick to say, well, we're not going to give up our data. We don't want to share our data. And I think it's important to understand that in order to do this, I believe they're going to have to share some of that data, so that in order to incorporate and become a better system, they really need to become a little bit more tech savvy in getting the information and the needs out there. And I know that there's checks and balances on it. And I brought up to them, somebody came here to my house and brought me a few jars of peanut butter from the food pantry, because it's just put in their bags. And I asked about that, and they say some people just walk in the door and circle everything, and that's just very hard for them to understand the distribution of it. I'm returning the peanut butter because I don't use it, but it's ironic that it would show up at my house when we've had all these conversations about how is it overseen. And I know that it's a very hard program to like oversee and say, yes, this person should have it. No, this person should not have it. How do you say that they should or shouldn't? But I think part of that has to do with them having to come in a little bit more into the next century on how to get food distributed clearer and more possibly. I asked, looking around, they told me that they didn't have perishables, and I'm a private chef, and I looked around at some of the things on the shelves, and I said, well, I could put something together here. Do you put out recipes for people? Do you think that maybe if you, and they were very adamant that that's not a good idea. And I think what I found interesting was, and they're like, well, people eat according to their culture. And I said, you know what, if somebody put out a recipe and said to me, if I have this, and this, I can make this. And I said, and it is extremely healthy. What I'm telling you to do is an extremely healthy salad. They would have to maybe buy one ingredient to add to it, and it would give them more protein than pretty much a lot of the things you're distributing. They said, no, we just don't do that. And I was surprised. I think what it continues to show is sometimes the inability to expand and look beyond, to take in, different ideas or different information and expand it. I talked with them also about the fuel assistance program and the rental assistance. And again, discussed the issues that I had already gone and spoken with everybody at the Interfaith Council about. And again, I got the same, they don't believe they come across that way. And I needed to give them exact incidences. And I said, what I really need you to understand is, and this is something I firmly believe in human services, is that if what you do affects one person, whether it's negative or positive, it affects so many others, because that's how they reflect going into that program. And when you're there to provide a service, you want to have a good rapport when you walk in the door, or you want to feel comfortable doing it. I know that right now, the Interfaith Council within the next year or so will be replacing some of the staff and are looking for a little bit more diverse. It will be interesting to see in the future how they look at that role and how they decide to whether change that role or expand it to maybe have a better concept of the diversity of everybody here and technology and the importance of technology in our world. Even though we might tend to not like it, we have to understand it. So that was mine on the food pantry. And then, so Linda's back on. So Linda, you want to go to the Artists Association?
Sure, you were on my speakerphone.
Yes,
with a
I was.
sleeping child.
Yes, with a sleeping grandchild.
I believe I wrote it down. I don't have that note in front of me. I believe they've done over 50 people have participated with the funding that we gave them last year, which was 18,200.
Mm-hmm.
And they have a variety of people. We did talk to them about a lot of elderly now, which is what I asked them to put it in our newsletter from the Saltmarsh Center. And so there's been a lot of elderly during the pandemic. They have teachers, firefighters, first responders are big proponents of this that otherwise couldn't afford to take the classes. And they'd like to expand it. And it seems to be functioning the way we had envisioned when we did a test run on this 2 years ago. Or 3 years ago, and the pandemic hit. So they've been able to keep the people far enough apart. They do, the precautions and stuff. And so far it's worked out very well for them. And they take painting, they take pottery, especially pottery. That's a really tactile thing, which seems to help a lot of people, especially those suffering from some form of anxiety from the pandemic. And they don't see it decreasing. They see it increasing because it's becoming word of mouth is increasing so much. And they will start to reach out to, because Dorothy brought up that age group between 18 and 22. And you can't really get at them through the school, and you can't really get at them through the salt marsh. So they're going to figure out, probably run through social media. And Dorothy said it's a little difficult when you go to their website. So I've suggested that they put a button on the actual homepage, the face page, and tell them that there's a possibility of scholarship money for these classes if you couldn't afford it. So I think they're going to look into that as well. But they're really excited about this program. And without us 3 years ago, they never would have been able to start it. So Dorothy can probably add.
I think that the one thing I liked, I think that's a good summary of it. I mean, they adapted which is exactly, what we like to see. They got the funding, they kept the program running through COVID. They adapted to make the program work and to utilize and get to the people it needed to. One of the interesting things I had, we had been in the middle of also discussing and talking with people on the cannabis grant. And it was interesting to hear that Dr. Lepre had sent patients to this program, and they felt that it had helped some of the patients that were in Dr. Lepre's Suboxone program, which was the only one that she really earmarked and said, oh, by the way, and we never asked. She said, I think I might have said something about trying to get the organizations together, and them being one of the ones I'd like to get into a discussion. And she earmarked that they had been working with Tim Lepre had suggested people. I think it's a great program. I think it has definitely proven to us that it's doing exactly what we're asking it to fund and providing the services. It is, the one thing we did find out is there is no funding available for this through any other grant process at the moment. And that Courtney does continue to look, but there is no other, and they don't have access to funds anywhere else to subsidize this program. Anything else, Linda?
No, and I think the impact, 50, 60, 70 people, I think the impact, the positive impact that she's seeing on these people for the minimal amount of money that we give them every year is, I don't know, I like to go for the big bang, the biggest bang for the buck. And this is one of those programs where we do have a lot of positive feedback.
Yes, we do. Okay, I'm going to move on to Fairwinds, and Fairwinds was actually interesting. Linda and myself were on a Zoom call with them for a while. It went from, and then Linda left to go to Art Association. I stayed on, Joanna came on. So you're going to hear from 3 people, but we were not in the meeting together, everybody. So we did not break any rules. Linda, if you want to, we'll discuss it. We sort of wrapped around all their programs in our meetings. So Linda, if you want to start, Joanna, you will go second and I'll follow up. Okay, Linda?
We didn't, Anne sent out, because they sent it to me directly. Dorothy and I had the advantage of seeing their response to the questions that were sent out to several of our grantees. And that was the most comprehensive response I've ever seen to any questions we've ever asked. And they had at least 4 or 5 people on the Zoom call. And it was very enlightening. I mean, they are light years. Anybody who's been on for a while knows where we've come from with Fairwinds. And they have got their act together, and they have, I believe, a new auditor that was specialized in this counseling centers. And they have a very active, involved board. They're just so much more organized. They have multiple services now. They are in a problem with their space. Somebody came to me the other day about maybe a space for them, so I have to flesh that out. But there's really not much to say, except that they have the
Linda, we lost your voice.
I'm still here.
Yeah, now you're back. Yep, you're
Okay.
back.
My internet connection's unstable. They have their act together. They're very excited about the program they're asking us for money for. They are working with Gosnold. They are working with Tim Lepre. We'll get to that when we get to the Tim Lepre side of this. And they are involved with the schools. They are involved with the emergency room. All of this stuff sort of went by the way, several years ago. Financially, they're in good shape. Their programs are in good shape. Their counselors are in good shape. They have a really good psychiatric doctor. Medication follow-up. I mean, a lot of the problems that we saw over all those years have been solved, and they've got a very active board and a very good administration. And they do go after every single penny they can get from insurance. They still have an awful lot of people that are on sliding scale, and they're not going to turn anybody away because they don't have the means to pay for it, and they will try to help them get insurance. If they don't have it, you're required to have it in the state. And when you file your taxes, you get penalized if you don't have it. So I'm very, very enthusiastic about where they are now. So if you read their responses, I don't really have much more to say.
Okay, Joanna.
Great, thank you, Dorothy. I fully agree with Linda. I thought that their written responses to the questions we asked and the fact that they had their group come on to meet with us and spend the time, and we asked a lot of questions. I asked a lot of questions, particularly about how this counseling program would work and how many people it would serve, and what was their thought process on being able to ramp up quickly should they get this money, and in terms of how many people they would serve. And their responses were, I thought, reasonable. I thought that it was reasonable how they thought they could roll this out in terms of how it would work, right? And so basically they think they can hire these peer recovery coaches who they'll pay somewhere between $25 and $32 an hour. They think they can increase their caseload to around 60 people, which means it will have an impact. And this sort of peer recovery coach would be supervised and also would be accessible to the folks as they needed them. And I really liked that. So meaning if somebody was, one of the examples they gave is if somebody was going to pull into Hatches and needed to talk to somebody and really get some coaching about not going in, then their person would be available to them. And so it was like a real time, real impact kind of a program. And I appreciated them and their answers to the questions. I thought they were very transparent.
Okay.
Dorothy, the only thing I wanted to add is, because we both asked them, what happens if you don't get full funding? Because we're $230,000 over on the ask this year. And they said they would do the best they could. They would probably be able to serve less than maximizing. They wanted to maximize the amount of people that came to them that would need support, but they would have to do less with less. So I think that's pretty much where that ended up, wasn't it, Dorothy?
Yeah, I was gonna go, I brought it back up when Joanna was on there too, but I want to get to that. There was sort of a mixed answer to that one. The mixed answer was they had received a $60,000 grant from DMH. 40,000 of it they're going to use towards the sliding scale, and then they would have 20,000 already in budget that they would be putting towards this peer recovery program. I asked whether the peer recovery program would go on if in fact they did not get funding. Were they financially going to back it? At one point they said no, then they said yes, then they said, well, they would have to see, well, then they could only do it to what they had the money available for. I want to go back to the fact that this peer recovery program was in place 2 years ago and they cut it and they stopped it. They didn't go for resources to fund it. And I think that that's something we have to keep in mind is we talk about programs that we want to see fund, we want to see go, and we want to fund programs that people say, oh yes, we will do it. We funded this program a few years ago and it just ultimately got cut out of their budget, and it got cut midstream. mid-year. They just stopped it. And we didn't find out it had been stopped until I think it was our third quarterly report that we found out that they weren't doing it any longer. So I think that, you know, you want to, consistency is great. I don't want to see them say that they're going to commit to getting 60 people service and then cut it. I want to see that they can commit and start and get it going and have it sustainable to grow from the sustainability of it. I think that that's one of the key things that we have to look at is getting programs going and making sure that they become sustainable within their own organization as well. And they can't oversee 60, you know, like somebody might only see one in the peer recovery and somebody might see 10 people in peer recovery. How many clinicians can oversee that? Right now, they only have one person that will be overseeing the clinicians that are doing that. So I would, you know, in my final thought process after listening to the whole thing was, I think that, of course, I believe the program is great. I believe any program that we can get out there, if sustainable and if viable, is good. I want to see that we're not looking at a program that, yes, let's go, boom. Yeah, sorry, we're going to keep coming back to you for this funding or not. And if we don't have the funding, we're not going to run the program. I'd like to see them have a program that they can get in and get running.
Dorothy.
Let me finish and I will, Joanna, you can go right ahead. I believe that Fairwinds has come a long way. We've watched them change, and we know that through leadership and through different initiatives, they have made dramatic changes to their programming and how they run. And that was part of it. Part of it was curtailing the programs they were running in order to run the ones that they were trying to master more efficiently. So that was my take on it. And my feeling was that I don't want to forget that I remember them having this program before and cutting it. And I don't think that, you know, a lot of people knew it. Joanna, you were?
Yes, I participated in this part of the conversation as well. And I understood that the reason the program was cut was because of COVID and they had to make some adjustments. That is what
Yes.
they said.
That's what they said.
That is what they
Yeah, but the program was before COVID, guys. It was fiscal year 2019 that it was in effect.
Right, but if they had to shrink because of COVID, I'm not sure we should penalize them for that.
They had to stop halfway through the fiscal year in order to, because of COVID.
Yeah.
Fiscal year 2019 was not COVID.
No, but it was the following year when they got the money. I'm trying to figure out fiscal year versus not fiscal year.
They got the money for fiscal year 2019. Just so we're clarifying that 2019 was not the fiscal year of COVID.
No, I know it was fiscal year.
It was July. They got the money July 1 of 18 then, if it was FY19. I thought it was the following year.
No, sorry. So I'm just putting, I'm not penalizing what I'm.
Dorothy, I think this is a really important point, and I think for two reasons, but I want to come back to that. The other thing is that both Amanda and Christy would be supervising this group of up to 60, right? People that would be served. It wasn't just one person. It was Christy operationally and Amanda clinically. So it wasn't one person supervising them. And the reason, Rosie, you're going to have to be quiet for a second. Sorry. That's okay. The reason I think this is important is because, and I know we'll talk about this shortly, is the conversation we also had with this home. Because I do think that this is being able to sustain the program. And I'm going to have to put the dog out.
Okay, go ahead. We'll wait for you.
Maybe she's going, yeah, I have to put her out. Sorry, I'll be right back.
Yeah.
Dogs are like little kids. Whenever you get on the phone or you have anything to do or somebody shows up, It's the time they need you.
Okay, sorry about that.
I was just saying their dogs are like little kids. Anytime you get on the phone or somebody shows up, they need you.
Well, plus on top of that, she gets jealous if I talk to other people.
Yep.
Anyway, I think this is a really important conversation to have, because in the context of these dollars and the money, you know, to the point of what Linda said, you know, we have $230,000 requests and probably likely a little more than $100,000. But this piece that you're raising, this issue of how sustainable are these programs, is super important, because after we met with Gosnold, I don't feel like that program is sustainable hardly at all.
Yeah.
They have such a little
Wait,
foothold.
Linda, you weren't on the meeting, so let's let
I mean,
Anna.
first of all, the scope of the number of people that they can see and support is so much smaller. And the availability of those soap recovery people is so much smaller. And also in the last couple of days, I just took an opportunity to look at all of their marketing materials, which is very, very almost vague and too basic. And there's no person that it directs it to. There's no person who is stepping in front and saying, call me, I'm available, give me more information. I don't feel like there's a real stronghold that can be developed. And when you look at Dr. Lepley's program, and I wasn't on that call, but if you look at what he's doing and the fact that he has longevity in the community and a reputation, and you look at what Fairwinds is doing and the scope of what they're able to recover and provide, right? So if Fairwinds can serve 60 people and Gosnold can say they'd like to service 12, but really they think that the number is 4 or 5.
at a time,
Okay.
That's crucial, at a time, not in the
But
whole.
that's
program.
right, but
Within-
that's like basically she said that's a 12-week, that's 12 weeks. So if we're 4 or 5 people for 12 weeks over the course of a year, we're still not at 60 people in a program. And if we're really listening to what folks are saying, I mean, if we're looking at 56 people needing transport off the island in the ambulance, right? Then we're at 60 people who need that kind of support when they come back.
Well,
Right?
because those are two completely different. programs.
I understand.
Just want to make sure the hospital is mental health.
Yes.
Most of it is mental health. Okay, that's going off. It's behavioral health. You know, it's not all substance abuse that's going off. So let's not bring the ambulance into the discussion.
I understand, but there is a ratio there, right? And also I think the insurance piece of this plays a role. I just think that Fairwinds was far better prepared, had far better answers to the questions, and has regardless of what we think about their history, has a well-established presence on the island that is not going to go away. And it's that there's no threat that it's going to go away. Anyway. I mean, you were in the Gosnold meeting. I mean, I feel like
I've had 3.5 hours of meetings with Gosnold in the last week. So yes.
Yes. I just.
But you can discuss your Gosnold and I'll discuss Gosnold as I saw it.
Yes. I mean, I feel that
So we're moving on to Gosnold, everybody.
I feel it's a very risky proposition to give them any money. I don't feel like, first of all, it was one person who came to the call. The questions that we have had for them have been really deeply around how many people on your team are here on the island, right? Who's full-time? How are these people going to be serviced? And nobody else came to the call. I thought that was just not, she wasn't even the person on Nantucket. Right? Like, where was the person from Nantucket who could have assured us that? And then basically she said, well, NAMI's taking over the office and they can provide a full-time person in the office. Well, these are fixes, right? For a longer term problem. And I firsthand, I know how hard it is to hire people and have people live here and find housing. And so I don't know how sustainable that will be. I do say that on the flip side of all of that, as much as I wasn't impressed with all of their marketing for this soap stuff that I've seen out there, because again, there's no person referenced, and it's really hard to respond to cold ads for help when there's not a person. I know they're successful off island, right? So I'm having a hard time reconciling this, what they're representing on Nantucket, with how they are out in America, right? That's it.
Are you done? Are you done?
Yeah. I'm done.
Okay. I didn't know if there was any more. So I think I've spent a lot of time trying to better understand. Maybe they haven't mastered the presentation part of what they're doing for us. And didn't have everybody. I think Fairwinds has learned over time, they do better when they have a group that comes forward. The person that we spoke with is Allie. She's the head of clinical care for Gosnold. And so she is in charge of the clinicians throughout the Gosnold programs. I did go out myself and meet the gentleman that's running the office on Nantucket. I went in and saw him. I believe, and I said this before, and I've said this to everybody. It's not that I don't believe in the program, the peer recovery program. I've seen them start it. I've seen it go off. I've seen other programs start and I've seen them go off. The ER is covered by Gosnold. It is not covered by Fairwinds. The Gosnold has the ER contract with the hospital for emergency care. Just to clarify that, Fairwinds does not have the emergency contract. And they do have a clinician that sees people on a regular basis here, and they do have patients that are in telehealth here. So they do offer services outside of the SOAP program that we are discussing, providing in, maybe giving grant money to. And what is, I really think that is really important, and I've said this, and it comes from my heart and it comes from life experience. We cannot put, and you cannot believe that everybody has one way of being able to get through recovery. Programs like the SOAP program offer what no one else offers here, which is when you leave recovery, when you leave a program, it gets you into the everyday life function. The peer recovery program is a great program. And the best way I can say is that to me, the way I see it in describing it to somebody is it's almost like your sponsor at AA, a little bit more elaborate, but you have somebody there that you can reach out to when things go bad, or when you're feeling that you're not in a great spot. The problem is having to find a way to get back into this community as a whole, and having to find a way to manage life on an everyday basis with trained people showing you the routes and being able to show you and give you the tools to make it. And that's what the SOAP program is about. It's about integrating people back into communities so they can get into peer recovery programs. And I think that we're missing here is that we have steps, and there's steps in recovery. And we have proven that we don't have that step here on the island. We don't have it. Fairwinds, for everything they've done, and I've supported the changes they've done, and it isn't, they don't have this mastered. Nobody does. But out of everybody coming to us, this organization here has the greatest tools behind them to make it work. And we haven't had a chance to see the impact this program can have on individuals. So as much as we say, let's get 60 people possibly into the peer recovery program, because you have to find peer recovery coaches in order to do it. Is you have programs that offer this level of care. And for some people, this could mean their children coming home. It could mean their loved ones coming home. And I don't know if any of you understand the impact that has on a family. And I am going to say this, as I said it yesterday, it took 8 years for me to have one of my boys to be able to come back to the island. I don't know that he can stay here. This kind of program might have made it that they could have come home. And for all those families out there who have children that have not returned here, we have to keep that in there. So I don't want it like shut down because we don't believe they have the sustainability. Have we given them the chance to show it? So don't take it off the block because you don't feel they're showing you the sustainability. We have to give them a chance to prove their sustainability. That's my feeling. That's my feeling. And I'm coming at this from, I think, a lot of different angles than maybe everybody else, and an understanding of what the impact that program can actually have. If we want to keep debating it, we can keep debating it, but I'm just letting you know how I feel about it.
We're not at the point of debating the money at the moment. We're just doing our reports from our site visits right now.
Yeah,
Because I got a lot to say about this one, as you know, and I don't want to get into it now if we're not talking about the money part of it yet. We're just talking about our visits with these.
Our visits and the impact. I mean, this is the kind of conversation that we actually should have had while we were in deliberate, like while we're talking with them. So this is what's important, is to understand the whole.
I mean, Dorothy, I hear what you're saying, right? I hear what you're saying, that this is a specialized type of care that nobody else is offering, and that there are certain families that can that need this type of care and that can help them. I still think that it's this ratio of what's eventually going to be the dollars that we describe and assign to each of these organizations in terms of what the overall big picture is and how they can help them. And that's the part where I probably will end up being stuck. And I do understand what you're saying about people, families who this is affected on Nantucket and being able to have their children come back here. I understand we don't have certain services here that would allow that to happen for different types of kids. I get that. And it's hard. I think it's very, very hard for those families who have been affected by this kind of tragedy. Right. And in the same way that not all, that's why I was asking some of those questions about AA, because I think that the other thing that happens, and I don't think I've probably ever shared this with you either. One of my sister's brothers was lost. One of my sister's husband's brothers was lost to this type of an issue. And also I did a very big project for a recovery center called CMC in the Berkshires, Center for Motivation and Change.
Yeah.
Yeah, I worked there and worked with those people on a consulting basis for a while. And so I have some exposure to this, but certainly not the kind of exposure that you have. But in some ways, what I was able to see from those experiences was making people feel, to your point, that they have to fit into some sort of cookie cutter answer to the steps of, this is what happens after this event happens in your life, right? That this is a cookie cutter prescribed path. And so I like the idea of offering different options. I just think that there's a practical reality about what's going to be able to be successful in our community based on the resources that we have and the situation with office space and personnel. And I would be concerned about investing in things that may ultimately not make it. And I think that Gosnold, in terms of the level of its sophistication, not on Nantucket, in America, can do better than what they did for us, right? So that's the place where I have the rub, right? They are doing this successfully in mainland America, right? They have the sophistication to be able to deliver these programs. They just haven't put the effort into Nantucket. So while I agree with you in a lot of what you're saying, what I see from the example of this, and I went to all their other websites and looked at all their other stuff and see what they're doing in America and looked at their marketing and looked at what they're doing here, and they're either not spending enough money here, they're not spending enough money here, and they're not assigning enough talent and time to make a strong foothold here. And so for me, if I was going to be giving them dollars, that's the place where they would dramatically need to put effort. Right? Because you can say they created this partnership with NAMI. NAMI is like, again, nationally, a great organization, but here, just a very, very small grassroots organization who has had more social impact through, social media and marketing programs, but the actual success of those programs have been very small, right? Because I've had some involvement in that with another project that I was working on. And basically they gave us money, but very few people ever came to the program, right? So this is complicated, and complicated further by the fact that we don't have a large pot of money to give away. And the money that we do give away has to be thoughtfully, this has to be thoughtfully invested in programs that at least have a really good chance of getting a stronghold here. Yeah. But I appreciated this because I didn't know all these things, and it was really enlightening.
Okay. Well, I want to go on to NAMI now. I actually interviewed with NAMI. And we have I think everybody's gotten the follow-up from NAMI on the questions, along with their procedures and policies that they have put into place. Brooke, I hope you saw that. I understand that this program, again, is working. What they're asking for funding for is to do the sliding scale with independent therapists. They have 9 therapists. They've seen 90 clients. They're even, and in discussions with Fairwinds has said that they have been sending clients to the NAMI program, to the other programs. It is a sliding scale. As with a lot of private practices, in regards to Brooke's question on insurance, some do insurance, some do not do insurance, if applicable. The whole process was of this, and the grant behind this, or their request, because the program they're funding right now, they got a grant for this, the initial program, was to service the underserved and the people that don't feel or have had experiences that Fairwinds as a group doesn't fit them, or that Fairwinds doesn't have the time to see. It seems to be, with 90 clients getting 2 to 3 visits a month, it looks like it is serving the need that they're looking for. They're asking us to help subsidize this since the grant that they got for the first year has run out. I believe that NAMI itself does do great. You're right. They do great social media. They have been backing some very good programs. Their addiction program has had good success. They see, sometimes they have 13 families sometimes involved in that. When they're doing them 4 or 5 times a year, that's a lot of families. And maybe they see 5 or 6 people or don't get that many, but mental health on its own right now, as we all know, is only beginning to be recognized as a program where it's being recognized. It's like substance abuse. We're finally being able to say it's not such a bad thing. We have to understand it. We have to understand the disease of both. I've seen that I did reach out to them. they have reached out and are working, trying to now begin to work with Tim Lepre in the Suboxone Clinic, which I believe is going to be great. That's one of the keyholes in that program. I think that really needs help, is therapeutic end of it. So all in all, I think that the idea of this program, it does offset a need that, or take care of a need that is not being taken care of for a lot of reasons. Fairwinds does not have the clinicians to take care of all these patients either that are out there. As every organization, everybody's having problems. We all know you can't get staff, you can't get therapists. It's a major problem for everybody. That was one of the stumbling blocks that Gosnold had, was finding somebody that would be able to come here and to commit to the island. And in speaking with Jason and everybody else, that's a commitment Fairwinds has to. Everybody seems to be having problems with clinicians due to, of course, salary and housing being a big one for everybody. And this program that Naomi has put together is using clinicians that are based here, that were willing to get involved in the program and take on and do the sliding scale. So I think it serves a need that we have, and it complements other needs that are here, other programs that are here. I'm going to move on from that and go to Tim Lepre's Suboxone Program. Linda.
Dorothy, I did not see NAMI's response. I cannot find it in my email inbox. I'm not sure how I missed it.
I will have Anne resend it to you.
Thank you.
You're
I
very
didn't see it either, just so you know.
I will have Linda send it. I'll have Anne resend it to you. Okay. Everybody we'll make sure it gets sent back out. Okay. I can find out the date that it got sent if you give me 1 minute. But Linda, why don't you start with the Suboxone Program?
Okay. I say up front, Joanne, I'm with you on Gosnold.
Well, we're not.
This was terrific. This was eye-opening. He met with us in between patients, and we were supposed to be there for less than an hour. We were there for an hour and a half. He's pretty much doing it on his own without support from the hospital. They've had some help from other outside sources, people that have had family members that have suffered from this, or they've lost family members from this. The Community Foundation, I believe, supported them as well. He and I can't remember how to pronounce her name. Is it Elaine? Elaine? I couldn't quite get her first name.
I think it's
I know
Elaine.
her. What is it? Elaine?
Elaine.
Yeah, I just know her as Mrs. Womack. She was in this business, this particular venue, when she was in San Francisco. So she brings with her a tremendous amount of knowledge and just basic understanding of the pathology of addiction and how to get people back on track and living their lives. And they are working with all the other entities. But they do have a shortage of funding, but as far as they're concerned, whether they have funding or not, they're going to keep going. It's just going to be a lot easier if they have support. What did they say? They were over 100 people that they're seeing now?
No. They see
40 regulars,
80,
40 regulars, and then there's the fluctuation.
An influx to about 80 something in the summertime.
Summer, and then so it's my questions had to do with the addiction to Suboxone. And apparently it's not, as you can find anything on the internet you want to find. And there are plenty of sites, reputable sites, that say that you can do it long-term to keep people on track without going through the horrible withdrawal and going back to the substance abuse. And people can maintain on Suboxone for years. It's all to the personal goal of the person that's involved with the addiction. They follow up on them, both of them, all the people in the program have their cell phones, and they can call them at any time for support. They'll come in on weekends. They have a clinic a couple of days a week, official clinic. And they do follow-ups, and they just, there's so much information that you had to be sitting in the room almost to get all of it. But I was very impressed by what he's been doing for 10 years and what they continue to do with limited resources. And they did have access to a psychiatric nurse, and they don't at the moment. So Dorothy, you may want to elaborate on stuff, but there was just so much information. I was just incredibly impressed about what they're doing, and they're the only ones doing it. Before that, when they had to send people over to the Cape for methadone, the people had to go on the boat. So they're here now, and they don't have to go on the boat, which lessens the stress, and a lot of which causes the addiction in the first place. So they tried to recommend counseling for them to deal with the reasons why they turned to self-medication in the first place. So they do have an open line of communication with Fairwinds. I think he does with Gosnold, but Fairwinds is probably their first point of go-to. But I was just so impressed with this whole thing. Dorothy, if you want to elaborate on, there's just so much information that I wrote down.
Okay, so let me elaborate on let's talk about collaborations first. They get clients to them from Fairwinds. Fairwinds will suggest a client go to them. They do a little bit of work with Fairwinds. They used to have somebody in the office doing the therapeutic care through the Tower grant. When they lost the Tower grant, that stopped because he didn't have the money. He didn't want to pay the money for the therapeutic end because they weren't seeing enough clients. One of the things is, and I'm gonna contradict a statement that Linda made, and Linda, you can correct me later. Suboxone is not a long-term drug. It is never set up to be a long-term drug. Please look it up online. Naloxone, if I say it correct, can be used for a longer period of time than Suboxone. It is a drug that you are supposed to try to wean off of over a period of time, in a shorter period of time. And one of the key components of this is therapeutic care in any medical assisted treatment. And Tim definitely is, or I should say the Suboxone Program or Addiction Solutions is definitely servicing a need that needs to be serviced on the island and a group that needs to be serviced on the island. But does it have all the variables it needs to have a successful, well-rounded program? And the answer is it needs the therapeutic end added to it. He does not get support from the hospital. That is correct. They hardly recognize the program that he offers. He does have clients. He has had clients that have slowly come off of it and do it on their own. And he said it's up to somebody to decide to come off it and when they want to. Coming off of it is, you do have withdrawal symptoms. So for some, that last little bit is a hard move to make. That last time, some people will just go down to the end portion of it and then come off. But it isn't recommended somebody be on it long-term at all in the medical industry at all. It is not a recommendation.
All right, that's why I want to contradict, because I specifically asked him that question, because that was my concern. You and I had talked about that. I specifically asked him that question, and she also said they can be on it long-term without detrimental effects, like I had asked them about, which I had read about also online. And they said, not got websites that say they can be on it forever. And they both said they could be on it long-term without having to come off on a maintenance dose, because I specifically asked that question. So, and you and I both expressed reservations about that, but they both said they could live their lives, return to society, that most of them are working, and said they can be on it long-term. And they said it's their, if that's an individual goal, and he mentioned one person, if it's their goal to get off of everything, they will work with you to do that. But until that time, they said the goal is to keep them functioning, keep them going, keeping them living their lives for as long as that works. And they said it can be long-term. So I just want to clear that because that was my first question to them.
Okay, what I said was, I did not say that that's not what Dr. Lepper said. I said that they said that it was maintainable, and I said that there are people that can wean themselves off of it.
Yep.
What I did say is in the medical field nationwide, it is not a maintenance, they do not recommend it as a maintenance drug. That's all I said. I want to make that clear in that.
And I saw the same stuff, but I also saw stuff that it could be on, from Journal of American Medicine, that it could be on and maintenance. So I'm sure that there's a lot of disagreement in the medical community, but we're not doctors. But I just asked him that question for reassurance. So
Yeah, no, we are not. I never said we were. I'm saying that the biggest proponent also, when you read all this, is the therapeutic part of this program, which really is lacking. And not that what he's doing isn't good. I'm just saying that that's a very major lacking part in this program, because you want that therapeutic end to any medical assisted therapy.
right. And they said that they always recommend that. They also refer people over to Fairwinds directly, because if
Well,
somebody
Fairwinds wasn't the only one they discussed. I want to just make sure that everybody understands that all I'm trying to say is this program is, I'm not saying anything. I'm saying my biggest concern with this program is the therapeutic end of it. So if I can finish, was the therapeutic end of this. And so my biggest take back from my meeting with him wasn't that what he was doing wasn't affecting or making change for people, was that there was some way or another, we talk about what our goal is and what we do, and we fund these programs. What we need to do is start getting these programs that we are funding to work with each other to make their programs better and stronger. And that's where I was going to aim at with my ending with this program, was that I walked away from it and really realized that I want to sit down. I want to call some of these stakeholders to the table and work with them through understanding that there is a way they can all not only better themselves as programs, but if we could get all these addiction programs, and all of them have some form of help with addiction. We realize that, Health Imperatives does a little bit with it. And then you have the Artists Association doing something, and you have Fairwinds, and you have NAMI, and you have Tim Lepre, and you have Gosnell, but they're not all working close enough together to help enhance each other's program. And the biggest thing I saw lacking from Tim's was the therapeutic end of what a medical assisted program was. So what I was going to come back with and say to everybody is that I've walked away from it, and I've said this to Jericho. I want to get these people together on a table. I want to get them talking. I want to find a way to make them start working, because not only will they help each other, if we can get that core working together, there are $1 million grants sitting out there, millions and millions of dollars grants that just core group could come together and get and facilitate if they showed proper collaboration. So that was my end thing about everybody we met with, was if we could just, it's what I see happens is, even here in our group, everybody, we look at that and we sort of fight for money for different organizations, and they're fighting for it. But what we want them to start doing is working together to get all that money to better enhance. So this would be nothing compared to what they could get in major grants. They have the ability, they're out there, and other towns and other communities, the Berkshires have done it, and they have done amazing multi-million-dollar grants are out there running programs because they collaborate, and they show active collaboration. They show they're willing to work together, and they do it. They don't say it. They start saying, well, okay, Tim has this program. I've asked Gosnell. Gosnell is going to begin to go in on Fridays for an hour, the SOAP program, to Tim's program, to see if there's a way that they can interwound with these people. That's what we need them to do. We need all these programs to start doing this, to start going in, because there might be that person that's weaning off of Tim's program, that soap program is going to help get moving further, you know, or that they can get teleservices to, and NAMI, who has the ability to get free therapeutic care. Maybe somebody can get into a therapeutic care there. So if we can start getting them working inside the other programs, we can start enhancing them. That was my take back.
My final comment on this is that Tim admitted that he's in his lane. They are so overwhelmed with this in his own practice that he is in his lane. He does know that he is a cog in a wheel of support for people with addiction and mental illness.
But he
So
said he's willing to
he
take
does,
that
hold
up.
on, he does understand that. He did say that. He said, you know, they are not equipped to deal with the psychiatric issues or the mental health issues, which is why they deal with what they deal with and then recommend and try to work with the other entities to get people support. They can't force somebody into mental health care. You can't. Plus, there are HIPAA violations among various groups that you can't give out too much information or names or certain things like that without the patient's permission. But he did admit that he's in his lane, and he did admit that, you know, he's part of the big picture on trying to support somebody, whether it's food insecurity, housing insecurity, they're out of work because of their addictions. There's a whole big picture and of somebody who needs help. It's usually not just one problem with their addiction. There's usually a bunch of other things that either created the addiction or as a result of the addiction. So he said, you know, they understand that, they acknowledge that, they understand they need to work with everybody else. He and his wife sit there at their table at midnight, as he put it, and do the grants, and neither one of them are grant writers. So I said, there are people who are in Nantucket, anybody wants to give me a name, that will help them write grants. And Dorothy did bring up the fact that if there was a collaboration among certain entities in the healthcare, that there may be bigger asks, maybe more requests coming, you know, maybe more things granted if there was a collaboration among groups, because certain groups don't get funding because they didn't collaborate. They can't show collaboration. So there's this whole thing about moving beyond just him staying in his lane and helping that program actually work with another program on a grant, get them a grant writer that will do it for free because they can't pay for one, and sort of try to, you know, network a little bit more than they are. And Dorothy getting all the stakeholders together in one table for a charrette of some sort is a great idea. But right now they're putting one foot in front of the other because of the absolute need for their program. But he does realize that he's just one part of all the other programs that have to support these people.
But he was open to having people come in and help him with the therapeutic end of it. I want.
They can't do it in his office. At the
Huh?
moment. They can't do it in his office at that moment.
No, he said that he does have the space. He could have somebody come in and be there available.
Well, they had a psychiatric nurse, which was very helpful, but that's not available anymore.
Right. the
Him
hospital.
directly.
Yeah. So anyway, it brought up maybe a bigger picture item for later as to, like I said, I would like to get all these stakeholders maybe in a discussion and better working with each other on this very huge issue that we have.
It
And
was fascinating. It really was fascinating to have this discussion, you know, face to face.
yeah, he definitely believes in it, and he's been there. He's done the work. I don't know if anybody ever saw all the questions, but I asked, I'm going to just lighten the mood for a minute. I asked everybody to answer those questions. Those questions went out to everybody that was above 25,000. And if anybody had the chance to see Tim Leprey's answer to number 6 was, he'd just get in his damn car and drive down the hill. Which was, does weather get in your way? And he said, no, I will just get in my damn car and drive down the hill.
It was his 4-wheel drive truck.
With his 4-wheel drive. That's what he said. Nothing will get in his way. Which was, admirable. South Coast Legal Services, I don't believe that there's any real need for discussion on that as far as a review. I didn't reach out to him. It's pretty out there. We all understand it. And the Elder Services, she was away on vacation, so was unable to get an appointment in there, but I feel that elder services, I didn't feel that I was missing on something because I think we all have a pretty good idea of what they do and the people that they serve and the scope of what they provide for all of us. So, and what I would like right now is that looking at the time, I think that we're gonna, I think that we'll go into our recommendations in our next meeting. And because I just don't want this big debate to go, I know there might be a big discussion on all of them and we're close to a half hour out. But was there any other questions right now in regards to anything? Did anybody, Bert? I'll get to you, Brooke. I just saw your hand go up, so I'll get to you in a second. Can't hear you, Bert. Just volume. I can see you.
Okay, I had it on mute.
Oh,
No, I was just trying to, I had the agenda up on my computer screen. I was just trying to click on it to drop it off and it doesn't want to do anything.
okay. So do you have any comments on anything that you wanted or questions you had for any of us that went in on these site visits?
Well, one thing that I've discovered is with my new granddaughter is none of the facilities, none of the behavioral health facilities, including the hospital, have anybody who deals with postpartum depression.
Oh, that's interesting.
Yeah, you think a hospital with a maternity ward would have a person lined up, if not here, you know, on the Cape or somewhere where you could get, they could set up meetings and whatnot. So I know my daughter-in-law has had an awful time. She's been doing Zoom things down here with a support group here in Florida.
Well, they
Okay.
did say, Dorothy, correct me if I'm wrong. They did say, Tim did mention when he lost his psychiatric nurse in his office. Didn't you say that the hospital has hired a psychiatric nurse or something in that hospital now? They have somebody in the hospital that does that?
No, the hospital was looking for it, but I would say that when she comes back, Bert, if she comes back and is still in need, I would reach out to Sarah and see they've hired 2 clinicians to work at the hospital. And I see that Brooke is on to something, so she might be trying to find you a name of somebody that might be specializing. Oh, no.
Well, they're all
Sorry,
down.
Brooke, I just thought maybe that's what you're up to.
No, they're all down here now with me in Florida. So
Oh,
because her parents have a place down here in Florida too, so they had
Oh.
to come down and show the new baby to all the in-laws.
okay. That's very interesting and worth, I'm gonna ask about that. I'm gonna send a question out today and ask about that.
Yeah, but I thought it was kind of strange that and they said you could go to Mass General in Boston, they might have somebody up there. But I mean, if you've got a maternity ward, it's a reoccurring issue, I'm sure, with women to different degrees with a postpartum depression issue after they have a baby.
It doesn't usually show up, Bert, until after you've had the child, you've left the hospital environment. So they wouldn't necessarily have anybody in the maternity ward, but
No, but I mean, a hospital that has a
cares.
maternity ward should have something to take care of that issue later on.
Yeah,
No,
right. Here's a
that's-
pamphlet. Here's a pamphlet giving you information on what to watch out for postpartum depression.
Yeah,
And then
yeah.
if you need that, seek help from X, Y, and Z. Yes, that should be given out to them when they're up there.
You know, I know, but I think what he's saying is that we actually don't have a clinician that specializes in it, which is great to know and worth investigating. And I'm gonna reach out and ask Fairwinds about that today. And
Yeah.
I'll ask Sarah at the Cottage Hospital a little bit about that. 'Cause
Okay.
that's a good thing to know.
Yeah,
Thank
I mean, I kind of just assumed that when you have a maternity ward, to be somebody to deal with these other issues that follow maternity.
Yeah, no, I think that's a good one.
Yeah.
John?
No, I can't say that I have anything to add to this pretty, what should I say, deep diving discussions.
Okay. Ruthie, I haven't heard from you. I haven't even asked you. Is there anything that you have any questions in that we talked about?
No, I don't have any questions. I just have a few comments for the pantry. I do feel like with what was said about the diversity in the pantry, that definitely needs to take place, as well as the people feeling a little insecure about going in to ask for assistance with the pantry because of the different treatments they've been getting, and they have been feeling like they were um a little bit hounded just because they want help. So that's just my say on the pantry. Another thing is I love sorry,
That's okay.
choking.
That's okay. Are you, drink some water.
Yes. Yes, another thing is with Gosno, I love what they do. I actually work in the hospital, so I see what they do. And I see that they work very hard to getting patients off the island and assisting the patients. The only thing is I do see that it the collaboration is a little bit hard between them and all the other behavioral health companies, as like Fairwinds and Dr. Leprey's office. It may be a little difficult. I think it's a great idea if they do collaborate. I don't know if that will happen, but I do see that with them not being able to have staff on the island, it can be a major, major issue. So I am partly in favor with Gosno, but I am mostly in favor with the Fairwinds and Dr. Leprey's, only because I feel as though they are they have Nantucket at heart. Yes, Gosno is very strong with America, as we say, but Nantucket is a community that believes in supporting the people. They believe in the people here and doing for the people here. And I have grown to really love this community because of the love they have for the people. So that is why I would say that I kind of more favor with Joanna and Linda when it comes to the other behavioral health companies, because they seem to have more of a love and more of a stronger standpoint in helping behavioral health here on Nantucket. That's all I have to say. Thank you.
Brooke, anything?
I really want to refrain until I read what NAMI. Could you, if we could just have Anne send all of the responses to the questions in one email,
Yep.
resend them all in a single email, then they're all in one place for me to take a peek at. And I think I need to really think on the conversation we've had and the reports we've had today, and review those answers. And then I think, going into deliberations and a discussion about where the funds are going to go in our next meeting would be great.
Okay, awesome. I will make sure that everything gets sent to everybody, every single document that we've received, okay? And we'll make sure it's out in one thing, Brooke. Yep.
Dorothy, one question.
Wait, Brooke wasn't finished, Bert. Let Brooke finish.
Oh, excuse me. I thought you were. Excuse me.
So I'm just curious logistically, if I'm having to recuse on the conversation about the pantry, how I engage in a deliberation on the allocation of the resources on the regular CRC funding as a person who recuses on one application. I don't need an answer to that today, but I would, it seems hard to pull out one piece if I'm not allowed to be part of that particular piece of it. So Jericho, maybe that's just a question for you to ponder.
Oh, it's a
from a
question-
logistics point of view.
it's a
Linda,
question
I'll
for the
speak.
Ethics
Linda,
Commission because
Linda,
I've
I'll
been
speak.
through this.
Linda, I'll speak. We have had, John Balash has done it in the past. He's reclused himself on some, when it came to the hospital, when his wife was working actively at the hospital on the hospital board. And he just managed to, when it got to the discussion of the food pantry, he reclused himself and left for the discussion, just didn't participate in the discussion as to whether we were deliberating money to them or not.
However, Dorothy, this has come up before, and I've dealt with the Ethics Commission for 40 years now. This has come up before in other entities I'm on, and they can't participate in any funding requests. That's why we don't make that decision. Jericho doesn't make that decision. Libby doesn't make that decision. I have the phone number for the Ethics Commission on speed dial. But you need to call the Ethics Commission and explain to them what the entity is and what the deliberations involve. Nobody here can make that decision but you and the Ethics Commission.
Okay, Brooke, I will make that call, but I believe that we've handled it before with the ethics. I think we know it, but we will double check on it and get back to you.
Right, Dorothy,
Well,
you can't make the call. She has to do it. They won't tell you about somebody else. I just went through that.
Yeah, I'd like to explain exactly what the potential conflict is in more detail than anyone else here understands it because I think that's the best call. Thank you, Linda. If I could have that phone number, I'm going to make that phone call myself. Thanks.
Okay, text me.
Joanna, anything?
I'm good, thank you.
Okay, thanks. So I don't think that there was anybody else. So on that, I'm gonna say that.
No, Dorothy.
Oh, sorry. I went back. I just went back to the beginning of my screen. I see you. Sorry.
My question is concerning the food pantry. I see that the town is in negotiations to purchase that building. Does that affect them staying there for another year?
From what I understand, the town is not going to kick them out if they choose to stay within that building, but they are looking for a larger facility to lease.
Thank you.
What
welcome.
entity was that, Bert? I didn't hear that. What entity was that?
The Greenhound building.
Oh, yeah.
They're not, the town is not going to kick them out. Anybody else? Okay, great. So we will make sure that what comes out to all of you is all the answers we got from every single correspondence we've had since we sent out that request to every organization that was getting over $25,000 in funding, as well as their grant requests. And we will meet next Wednesday and go into full deliberations.
Next Wednesday.
I think it's next Wednesday, right? Because next Monday's, we didn't do Monday because it's Valentine's Day, right?
I believe the next meeting is scheduled for the 23rd.
Yeah, I
Oh,
thought there was a week. I thought there was a week between.
Can we please, would everybody be available, and I'll go one by one for next Wednesday so we can just get the deliberations done? And I'll start with Bert.
Yes, I have it down on my calendar already for next Wednesday at
Okay.
10 o'clock.
And it is the 16th.
The
This is
16th.
for Wednesday, the 16th at 10 o'clock.
Okay.
Oh, it's the 16th now. Okay.
Joanna?
Yes.
Thanks. Brooke?
I should be able to make that work. I'll be traveling, but I should be able to I'll call in from the road.
Okay, thanks, everybody. Ruthie?
Yes, I'm available next Wednesday.
Okay, great. John?
I'm available.
Fabulous. Okay, everybody, that's great. It was great, actually, good beginning of discussions on this. Making everybody think. I like it.
It hurts.
I like it when we think, I like it when we talk, and I like it when we make others think. It's good.
Dorothy, how much time should I block out on Wednesday? 2 hours or 2.5?
2.5 hours.
Okay.
And everybody, I'm telling you right now, it's every single deliberation will come to an end. on that day with the finances so I can go forward with my report.
Come
Because,
heck or high water.
yep, because Libby had wanted the final for the 17th. She's not getting it for the 17th, but just so you all know. Okay,
But we already have the 23rd booked.
we have the 23rd book. So everybody, I will make sure that Ann and I get all you the information. I am gonna ask for somebody to make a motion.
So
moved.
Oh,
moved.
so moved.
And all at one time, everybody up.
Okay, I'm gonna go with Bert Johnson. Did I get a
Motion.
second? Wait, I didn't
Yes,
hear.
Seconded.
second
Yeah,
for
we
Brooke.
seconded.
Thank you. Okay, so Bert,
Yes.
John,
Yes.
Brooke,
Yes,
Linda.
please.
Yep.
Is Joanna still here?
Yes.
Okay, Joanna.
Yes.
Ruthie.
Yes.
Okay, great. Thanks, everybody.
Happy early Valentine's to you all.
Yeah,
Ruthie.
Thank you, Ruthie.
thanks, Ruthie. Thanks,
Hopefully I
everybody.
get some,
Bye,
hopefully I
everybody.
get some golden Dansko butter cookies from my husband.
He does know the order is in.
Now on
Very
social media.
specific.
Hey, Linda.
Bye, everybody. Thank you very much.
Bye, thanks, Jericho.